Hi, I'm Dr. Ankita, gynecologist and laparoscopic surgeon. So today we are discussing about ovarian cysts. These ovarian cysts are like bubbles into the ovaries. There can be multiple reasons behind that. The most common reason being the hormonal disturbances and tumor formation. So these tumors can be cancerous or non-cancerous, that means benign. There are multiple varieties of these cysts. The first one, most common one, is the functional cyst. There are two types of functional cysts, that is follicular and corpus luteum. So what is follicular cyst? Basically, one egg or follicle grows every month and it matures and ovulates. When it is ovulating, it ruptures to release the egg. But sometimes ovulation does not happen and the egg gets trapped into the follicle, and this is known as follicular cyst. Now comes the corpus luteum. Corpus luteum is the end product of the ovulation, and the main function of corpus luteum is to provide protection or provide nourishment to the pregnancy. So the next variety of ovarian cyst is hemorrhagic cyst. The content of these cysts are blood. Next is endometriotic cyst. The endometriotic cyst will have chocolate material due to repeated episodes of bleeding from the endometrium trapped into these cysts. Next is dermoidcysts. The dermoid cyst has germ cell and it has a capacity to generate any kind of body tissue into that. The most common being fat and hair, but it can also generate tissues like bone, cartilage or teeth. So next variety is tumors. These tumors can again be subdivided into non-cancerous or benign and cancerous. Non-cancerous variety usually is cystadenomas, which can be mucinous or serous, and there is a cancerous variety which is again multiple varieties. So what are the most common symptoms and how a patient is going to present to you? So most of the times these patients remain asymptomatic without any symptom and are diagnosed on an incidental basis, or they can come to you with some vague symptoms which are not associated or related to ovarian cyst. Next is pressure symptoms. These usually happen when the cyst is very big in size, giving pressure on your bladder, bowel or ureters. Next is pain. Usually the pain is dull aching pain, and that is because of the pulling of ovarian ligament because of the ovarian cyst weight. So torsion is a surgical emergency. This ovarian cyst can also give you pain during your periods and while you pass motion or urine because of the pressure effect. The other symptom of ovarian cyst can include irregular periods or infertility, making it difficult for you to get pregnant. Now, what are the expected complications? The major complications are because of the mass effect when the cyst becomes very huge in size. Otherwise, the cyst can lead to rupture, torsion or converting into a cancer. Now, how these ovarian cysts are diagnosed? Like I said, most of the ovarian cysts are diagnosed on an incidental basis due to examination for some other problems. Next, if the cyst is very big in size, then we can definitely find out and diagnose these cysts on an abdominal examination. Otherwise, an ultrasound is the best modality to find an ovarian cyst, preferably vaginal ultrasound. Once we have diagnosed the ovarian cyst, we prefer to go for a CT or MRI to find complete information regarding these cysts. So how are we going to treat these ovarian cysts? The treatment of the ovarian cyst will entirely depend on the size and the type of these ovarian cysts. The treatment will be observation, medical or surgical depending on the above factors. Now, is your cyst going to reoccur? Yes, there are almost 10 to 12% chances that these cysts can reoccur in your lifetime. Now, one question which I get frequently asked by my patient is PCOD same as ovarian cyst? Then let me tell you, please do not get confused. They are very different to each other and the treatment is also very different. For your more queries, put it in the comment section.